How's it? It's TK. So today we stopped by to see Lance Uchida, who is Battalion Chief here. He's one of the guys who's the top right now for the task force and the team that is fighting against coronavirus for us here in Hawaii. This video might run a little bit long, but watch the whole thing and pay attention, because the information that is shared in this video could be something that could save you or a loved one. Share it with your friends and family and take care of each other, and we'll get through this as a community. Social distancing, aloha.
Welcome to your COVID-19 education, prevention, and outreach. Thank you for being here today. Let me give you some background information of why we're here and how we got started. So again, we're here dealing with a serious situation. The mayor had tasked the fire department to put together a multidisciplinary team to do consistent messaging, outreach, training, and prevention to the entire community, for the public, for the private, for the businesses, etc. The first thing we did was we formulated a multidisciplinary team consisting of the Hawaii Fire Department, Department of Health, Hilo Medical Center, the Mayor's Office, and Civil Defense. From there, what we did is we collaborated and thought about who was a vulnerable population out there, who was at risk and needed this training. And obviously, we identified several different groups, the one most vulnerable being the kupunas. This is a community issue, make no mistake. It's going to take all of us to get through this. It's not going to be about the federal government, the state, the county. It's going to take the entire community to get us out of this, right? So the other thing we talked about, or going to talk about, is getting informed, being prepared, right? And we combine all of this. It's going to take all of us to help keep us safe. With our group, what we wanted to achieve, or some of the objectives, again, consistent messaging from credible sources, right? We're going to talk about those credible sources being CDC, Department of Health, the County of Hawaii, etc., and the importance of that. That's our first objective. The second objective was to establish calm within the community. We want to do that, yet engage the community and everybody here to know the importance of this issue.
Let's talk about what is COVID-19. It all goes back to December 2019. There was a cluster of pneumonia in the city of Wuhan, which is in the Hubei province in central China. These individuals with pneumonia, they were associated with a live animal market in the city of Wuhan. And at that time, the disease was caused by unknown virus. Today, we know that it's a coronavirus, specifically COVID-19. So in terms of what we know so far about COVID-19, it is more contagious than seasonal flu, but it's not as contagious as something like smallpox. And in terms of severity of the disease, we know from the report from the WHO, 80% of confirmed cases report mild to moderate symptom. And the rest 20% may experience severe complications. Also, WHO reports that fatality rate of COVID-19 is 3.8%. So 3 to 4% out of 100 might end up dying because of COVID-19. It's definitely more deadly than seasonal flu, but at the same time, compared to other viral diseases like SARS and MERS and Ebola, COVID-19 is not as deadly as those. Just a snapshot as of today. These numbers change every day. It's important for you to know that, and you can also check the data from these sources every day. WHO declared pandemic a few weeks ago. So pandemic, by definition, is widespread of disease in multiple countries. And so today, we definitely meet that criteria. Initially, when we started seeing the cases in the US, the cases were all associated with travel-related cases, meaning that the person came back to the US and then identified to have the disease. However, today, we are seeing the case of community spread, meaning that we are not able to identify where it originated from. And individuals who are considered close contact might be at risk. So by definition, close contact means that somebody who may have taken care of a person infected with COVID-19, including caregiver or healthcare provider. We are seeing the evidence of community spread in many states, including New York State, Washington State, as well as small numbers of cases in Hawaii at this point. Center for Disease Control and Prevention has travel advisories. At this point, a lot of countries are at warning level 3, which is avoid all non-essential travel to the destinations. And then the rest of the world is at alert level 2, which is practice enhanced precaution for the destination. At the same time, another federal government, Department of States, also have a similar travel advisory. And at this time, Department of States actually indicated global health advisory on March 19, which means that basically we are not recommending anybody to travel. So the governor recently announced mandatory 14-day quarantine for all individuals arriving or returning to the state of Hawaii. Effective Wednesday, March 25th until April 30th, there's a statewide order to stay home and work from home. There are individual professionals that might be exempt for this order, including healthcare provider, food service provider. The list is available on governor's website. So if you want to find out whether you are considered essential worker or non-essential worker, ask your employer, and then also check on the website of government. Just like a flu or common cold, the disease is spread through respiratory droplets when you cough and when you sneeze. Coronavirus can infect humans by infecting mucous membrane. So your mouth, your nose are considered mucous membrane. So when you are in the distance where a person sneezes and cough, you might take that into your system, and then that's where the infection occurs. As you can see, COVID-19 virus has spike, which looks like a crown, which is why it's called coronavirus. These spikes bind and infect human cell and then replicate itself. Once the human cell is infected, the virus multiplies itself in the cell and then bursts into your system and then cause more virus. Because the COVID-19 is a respiratory illness, it affects your lung. So mucous membrane of the lung become inflamed, and then if that doesn't stop, or if you do not get better, you can develop pneumonia, which is a severe inflammation of lung, which means that you are lacking air, and also your lung might be filled with fluid. And when pneumonia does not get better or does not stop, individuals are at risk of acute respiratory distress syndrome, which means that you might be having a difficulty breathing. You might need help with a ventilator to breathe. And lung tissue often is inflamed, scarred, and then hardened or stiff. And for those who have acute respiratory distress syndrome, you might be at risk of lung failure or death at that point. So the symptoms of COVID-19 include fever, cough, and shortness of breath, just like a common cold or flu. And these symptoms might appear within 2 to 14 days of exposure. So incubation period for COVID-19 is known to be up to 2 weeks. So who is at risk of illness from COVID-19? So we're talking about kupuna or elderlies. The risk of developing severe symptom or complication increases as the person's age also increases. The fatality among this population is known to be over 20%. Additionally, people with certain underlying condition like heart disease, lung disease, diabetes, cancer, people living with HIV, anybody with a compromised immune system might be also at risk of developing severe symptoms. So let's talk about testing. So currently, the state of Hawaii is providing testing. If you're sick, you can ask your doctor, and your doctor is going to order the testing as needed. It's very likely your doctor will be looking at clinical features, so basically the symptom associated with COVID-19, as well as epidemiological risk factor, meaning that, for instance, have you been to affected area? Are you a caregiver of somebody who is infected? Are you a healthcare provider of somebody who is infected? Those are considered epidemiological risk factors. And then also, there are many other respiratory illness, including flu. Something like flu can be tested at your doctor's office. So something that should be first thing that your doctor should be testing you for. Department of Health is also able to test, but at this time, we are only testing those who are being investigated by Department of Health. So the treatment for COVID-19, because this is such a brand new disease, we do not have a specific antiviral treatment. At the same time, symptoms can be treated just like a common cold or flu. If you have certain symptoms, there are medications to treat those symptoms. Again, because it's a brand new disease, there are no vaccines available for COVID-19. These are the numbers as of March 23rd. These numbers will change every day. So go to Hawaii Department of Health website to find out the current situation. So it's really important for everyone to practice prevention. You can be healthy, can be infected, and then spreading the disease. In order for us to protect those who are vulnerable, we need to make sure to protect ourselves.
Okay, so what can we do to help prevent or help mitigate the situation with COVID-19? You know, it's definitely going to be a team effort. It's going to take all of us on the Big Island to work together and do our part to help us get through this situation. We know that it might get a little bit worse before it gets better. We just got to stick together as a team and everybody do their part. So when we look at what can we do to help this situation, we want to stay informed, plan, prepare, protect, to prevent. And I'll cover each of these aspects. So stay informed. You know, social media is a big thing that everybody has, and you know, many times social media, or sometimes social media may put out stories that are not exactly true, but here are some of your resources that you can go to so that you can get the most up-to-date and accurate information. So at the top, we have Department of Health, and that's their website there. That's updated daily, so you get a very up-to-the-minute data and information. We have CDC, and those are probably some of the two main entities that we rely on in the fire department to help with our operational response and the safety of our personnel. We lean on the Department of Health and CDC for the latest information. Hawaii County COVID-19 call center through Civil Defense at 935-0031 is another resource that you could call into. And of course, the Hawaii District Health Office at 974-6001. And the Department of Health also has an after-hours number, 211. I never knew about 211 until I started actually doing these presentations. So I learned from this as well. So these are, again, these are the areas or places you can go to get the accurate information. That's super important to get the right information. You know, when we plan and prepare, you know, we as a community got to plan. And some of the things we have to plan for, which we're seeing evolve now, is things like school closures. You know, many of us are parents. What are we going to do with our children when they're not in school? Who's going to watch them? What are they going to be doing when they're not in school? That's important as well. You know, we're going to talk about social distancing, so we shouldn't have 15 kids all at your house. So what's our plan? And, you know, who knows how long this might be? So some of the things that we can be proactive about. Canceling events. That's a big one for us. Parties, gatherings that are really more not necessary. You know, it's a culture change. Some things that we don't want to, but we might have to deviate or think of different ways we can celebrate certain situations, or even meetings or conferences and things like that would work. Travel, you know, we love traveling, everybody from Hawaii, but traveling should pretty much come to a stop at this time, temporarily, until we can get through this, yeah? And of course, activities, sporting events or extracurricular activities, it's great and it's good. It's good for the kids, it's good for us as adults, but hey, for now, I don't think we need to take a different approach, and maybe that has to come to a stop for a little while as well. Stock up on prescription medications and basic supplies is important, especially for care home operators, you know, their clients and the people in their care homes. Do they have refills on their medications? Do they have to go see a physician before they can get another refill on their prescription? Just kind of be more preventive, because who knows, maybe we might be on total lockdown. They can't get to a doctor. You can't get that prescription refill. So that's some of the things to just start kind of looking at and preparing for the worst, yeah? Preparing for the worst, hope for the best. A lot of people in our community have been talking about social distancing, but what is that? Well, we're recommending 6 feet. So 6 feet is kind of far. If you look at 6 feet, I have a tape rule here. If I were to pull this out for 6 feet, this is not normal for us, especially local style here, right? Normally we're up close, handshake, hug, whatever it is. But then now, with COVID, now we're this far talking. It's kind of weird, something to get used to, but we need to practice that. So it's a six foot distance from whoever you're communicating with. Spending extended periods of time around large crowds. That's another one that we need to avoid. Consider workplace preventive strategies, online meetings, telecommunication, VTC, video teleconference, things like that. We need to be creative, FaceTime, whatever it is. But do we really all need to be here in this meeting, or can we do it another way? So that's some of the things that we need to think about. Avoid unnecessary close contact with people, handshakes, kisses, hugs, things like that. And that's local style. For now, we need to take a step back and keep that social distancing. Screening and policies is something to look at as well. Employees. So if you're a business owner or you're dealing with people or customers coming into your facility or whatever it might be, screening your own coworkers is important. Are they sick? Have they been having a fever? Are they coughing? Any flu symptom? That's something that we should flag, and maybe they should not be allowed into your office, or they should be basically, if they're sick, they should stay at home. Visitors, we contacted a lot of the extended cares here on our island, and their screening procedures are very good, and they've basically stopped all visitors to their facilities, and that's great. It protects the workers, and most importantly, it protects their patients. So that's something that you might have to look at. Are you sick? And if you are, simple, you should stay home. Do you have a cough or congestion? Also signs of a flu or possible COVID-19. And do you have a fever? That's some of the general questions that we ask and we filter when doing our presentations or even at work with our employees. How do I protect ourselves? Of course, hand washing, 20 seconds. We use soap and water, and they say things like sing happy birthday twice to yourself. Very important, not just one side, but front, back, in between your fingers. And hand washing technique is super important, and do it frequently. Avoid touching your face, eyes, nose, and mouth. They say the average adult touches their face 90 times a day. That's a lot. I never realized you touch your face that much. And we had a question, why our face? Well, that's an entry point for a lot of bad germs through our mucous membranes in our eyes, our nose, our mouth. And, any breaks in skin, of course, is an entry point for bad germs. Okay, so avoid touching your face as much as possible. Avoid close contact with sick people. Okay, and I think lately, because of COVID, like anybody coughing, everybody kind of just looks and kind of stares at that person coughing because they're more aware of their situation awareness, which is good. Stay home if you're ill, simple. Cover your cough or sneeze with a tissue, then throw the tissue away in the trash. Clean and disinfect often. When we talk about clean and disinfect, a lot of businesses have implemented this into their business or their offices. Many medical facilities or care homes have doubled or in fact tripled their cleaning, how often they clean daily. And I'll touch a little bit about where and what can we use to disinfect as well shortly. So clean and disinfect frequently touched surface areas such as tables, doorknobs, light switches. So if you think about it, just keep it simple. All the things you come home or at your office, things you touch, even keys, cell phones, desks, things like that, is very important to decontaminate. Most common EPA registered household disinfectants will work and use the appropriate, used for the appropriate surfaces. And when you're talking about things that you can find at the market, such as the Clorox wipes and things like that, follow its recommendations and directions on the package. But as we know, that's been sometimes difficult to get in our stores because it's in such high demand. So what can we do? Well, we can make our own solutions. Using household bleach. For us, when we thought about how can we teach the community what the mixture is, so we have to keep it simple, and we thought of ways that we could demonstrate for the community that everybody would understand. So like for me, if you tell me 5 tablespoons of bleach in 1 gallon of water, I can understand that. Yeah, 5 tablespoons to 1 gallon of water, okay? Very simple. As you can see, it's very important to label your bottles or your containers, because the worst thing you're going to have is somebody thinks it's just water and they drink it. Yeah, and then that will be bad. Okay, it'll be caustic congestion. So label your containers. They do recommend making new mixes, batches every day. Okay, so if you don't need a large a large amount, it's just for like your house. You can use less. And again, something I can understand, 4 teaspoons to 1 quart of water. So 4 teaspoons of bleach and pretty much just fill this whole container up with water. And just a spray bottle. And this is more, I think, appropriate for like just regular household use. And again, label your containers so we know what's in it. And we should be making new batches every day of this stuff. When applying the cleaning agents, always use gloves if you have it. Follow the instructions. And if you're using the bleach mixture, we recommend leaving it or standing on the surface for 3 to 5 minutes after applying it, and then wipe it with a dry paper towel and dispose of it properly, basically in a rubbish can. And you can take off your gloves and, of course, always end with immediate or good hand washing technique. Okay, if you have flu-like symptoms, contact your personal physician, your doctor. Okay, if I feel sick, maybe a headache and just body aches and chills, that doesn't really warrant you calling 911. With COVID-19, our call volume is increasing. We only have so much resources. We have 16 advanced life support ambulances on our island. With the influx in calls, it can get very challenging sometimes keeping up with the calls. So we want to utilize 911 appropriately. So if you're just feeling sick, you can contact your personal physician. You can get filtered that way and maybe tested for COVID. What if I don't have a PCP or a physician? Well, you can call your local community health clinic or urgent care, and they can help you there. And many people don't have health insurance, so financially it's tough, it's expensive. Healthcare is costly. So if you don't have insurance, you can use a federally qualified health center such as Bay Clinic, and you also can go to the websites and to find out what other facilities are participating in our federally qualified centers. If you're having difficulty breathing and you need emergent care, call 911. Okay, that's important. If there's a life-threatening emergency, difficulty breathing, somebody have a change in mentation, not acting appropriately, of course, when in doubt, yes. When you have those kinds of cases, or if you're not sure, please call 911. Okay? And when you're calling 911, some of the important information to relay to our dispatchers are stuff like, hey, I've been sick, and the symptoms you've been having. Especially if you were tested for COVID-19 and you were a positive, please relay that information to our dispatch. That is super important, because not only does it allow us to formulate a plan when responding to your house or to you or your family, but it allows us to use our appropriate protective equipment so we as responders stay safe. And in turn, it allows us to give you guys quicker, more expeditious bedside care and get you to the hospital where you need to be treated. Okay? And because if our personnel use the equipment that they're supposed to be using to protect themselves, it keeps them in service, it doesn't affect our workforce, and we can keep our staffing on our vehicles and our 911 system up to par. That's super important. So again, utilize 911 as needed. Don't hesitate to call us, and please relay the appropriate information. And our dispatchers are trained. They're going to be asking you a lot of questions as well. It's going to take all of us, gang. It's going to be a team effort for us to get through this. We all can do our part, but all those little things add up to a lot. Yeah, big island, small place. We got to take care of each other, and everybody got to work together.
If there's one thing that would take away today would be, again, this is a community issue. It's going to take all of us together, one Ohana, one island, to get through this issue. Remember the social distancing, disinfect, wash your hands all the time, try to avoid touching your face, and again, be sensitive to everyone here. It's going to take all of us to get through this. On behalf of our COVID-19 Community Outreach Task Force, I'd like to give a shout out to Big Island Thieves Media and Any Kind Media. Thank you for helping us keep our community safe.